Hello, what's up, good people? First of all, thank you so much for coming back to my channel and checking out my videos. Before we proceed, please like, subscribe, and share this video for the best content and best research to the best of my abilities here. Today, I'm going to talk about a very interesting topic which is called tension headache. So what is the difference between migraine headache and a tension headache? Because the reason I want to talk about it here is some people don't even have a migraine headache. They just have something called tension headache, and they keep calling it migraine, and they keep getting treated by themselves at their home and so on and so forth, just thinking that it's a migraine headache. So how can you tell that you do not have a migraine headache and it's a headache from a different cause, from a different perspective, from a different, treatment standpoint, and so on and so forth? And that's called tension headache. So first and foremost important thing is the onset of the headache. How does it start, and how does it proceed, and how does it last? And how can you tell that you do not have a migraine headache and it could be just a tension headache and you just need to treat it in that way? That's what I am leading towards today. So first and foremost important thing is tension headache is not localized to one point, to here or here, unlike migraine headache. Like migraine headache would be like, okay, here's really bad, and I'm gonna fall down, and I am throwing up, and I am having nausea, and I am having photophobia or light sensitivity, and I am having phonophobia or sound sensitivity, and I am about to fall down because something is pulsating here, or just at one specific spot in my head. That is a migraine headache. But tension headache is totally different. It can start from one spot, but it's like a circumferential headache. It's like a bilateral headache involving two sides of your head, not just one side of your head, but two sides of your head. That's what we have in tension headache. And that's a very, very significant hallmark of a tension headache. And another thing is, some people call it like a band-like headache. Just like people who have a band, some sportsmen, they wear a band. That kind of band-like headache is called tension headache. And again, it does not have nausea, vomiting, photophobia, phonophobia, or pulsation that you typically see in migraine headache. On the other hand, migraine can overlap with tension headache. One or the other can precede one or the other. Let's say you got really bad stress because you have a really bad exam and you are stressed and you got tension headache. But if you are a migraine patient, you can have both at the same time as well. Or even if you are not a migraine patient, but you got a tension headache, but it can proceed into a migraine attack, or it can proceed into a confluence of both of these headaches. So it depends on the history. So we really need to poke into the details of the headache, that what sort of headache is it, what's the onset of the headache, how did it proceed, and so on and so forth about this headache. Another important point about this headache is, unlike migraine, it does not last that long. But again, there are exceptional cases. Usually, the timings are different between migraine headache and a tension headache. Tension headache could be as less as 30 minutes, and it can be as long as 7 days. So be careful about that, So because, modality of treatment could be a little bit different, and you have to be really careful what you are treating, and the diagnostics are different, definitely. And of course, the long-term treatments are also different. So please talk to your doctor about this subject if you're a patient with headache. And, with this kind of headache, It's a pressing sensation. It's not a pulsation. Like migraine pulsates. You feel the pulsation in that specific area. Here, you feel like compression. It's a pressing sensation that you have in this tension headache, not the migraine headache. And another thing is, it is not aggravated by physical activity. Whereas for migraine headache, it's aggravated. Let's say if you hit the gym while you're having headache, if the headache goes down, that means it's a tension headache. If the headache goes worse or goes high and you are gonna fall with nausea, vomiting, and pulsation and so on and so forth with that kind of pain, then that's telling me that it's not a tension headache, it's a migraine attack, because migraine pain, migraine headache gets worse with physical activity or exercise. Migraine patient likes to fall down or lie down or take some rest, take some break, stay away from the people, because he knows that this thing is going to give him some relief. Another differentiating factor between migraine headache and tension headache is the intensity. Migraine headache tends to be very, very, very intense. Of course, migraine headache would be very low intensity in the beginning, in the early stages, but then it gets worse. But with tension headache, the intensity is pretty consistent. It's pretty much at a certain average line. You have a moderate to mild intensity in tension headache. So please, think about it and learn about it and see what sort of headache do you have or someone around you have, and try to help yourself or help the people. And that's the purpose of my video today. I want to help myself, I want to help the people around, I want to educate the people around. So please like, subscribe, and share, and stay tuned for more videos. Live healthy, live long. Thank you so much. Bye.